Right now, in a hospital somewhere, a nurse is checking a small paper label taped to a bag of blood, 2 letters and a symbol, O positive, a negative, B positive, and if that label is wrong, if that bag goes into the wrong patient, they could die within minutes, not from the injury that put them there, from the blood itself. That single fact, that blood comes in different types and mixing the wrong ones can kill you, is one of the most basic rules in modern medicine. Every hospital on Earth follows it. And yet, for most of human history, nobody knew it existed. Rewind to Paris, 1667. A physician named Jean-Baptiste Denys is standing over a 15-year-old boy who has been bled almost to the point of collapse, a fever treatment that was standard at the time. Denys tries something almost no one has done successfully before. He opens a vein in the boy's arm and lets sheep's blood flow directly into it. The boy survives. Word spreads through Europe almost instantly. Blood from an animal can heal a human being. Doctors across the continent begin repeating it, convinced they've found a miracle cure. Then it stops working. Some patients live, others convulse, their backs seize with pain, their urine turns dark, and they die within hours. Same procedure. Sometimes the same doctor, completely different outcome. One of Denys's own patients, a coachman named Antoine Mauroy, barely survives 2 transfusions of calf's blood, then dies months later. His widow accuses Denys of murder. Denys stands trial and is acquitted. Historians today suspect Mauroy may actually have been poisoned with arsenic by his own wife, unrelated to the transfusions at all. But the damage is already done. Blood transfusion is banned in France. England and the Vatican follow. For roughly the next century and a half, the entire practice is essentially frozen, abandoned as too dangerous to touch. Nobody can explain why it worked sometimes and killed other times. And to understand why nobody could explain it, you have to go back even further to the idea of blood itself. For over 2,000 years, Western medicine ran on a theory laid out by Hippocrates around 400 BCE. The body was governed by 4 fluids, or humours: blood, phlegm, black bile, and yellow bile. Health was simply a matter of keeping them balanced. Under this model, blood wasn't something that varied from person to person in any deep way. It was one universal substance, identical in every human body, just present in different amounts. Too little blood, add more. Doesn't matter where it comes from. Sheep, cow, stranger, it's blood. It's all the same stuff. And honestly, why wouldn't they believe that? Look at blood under a simple microscope, or just with your own eyes. It's red, it's liquid. It looks completely identical from one person to the next, one species to the next. There was no visible clue anywhere that blood might carry something invisible and specific to each individual. The theory wasn't stupid. It was working with the only evidence anyone had. So when transfusion attempts kept going wrong for 150 years, doctors had almost given up on solving it until one man in London refused to. In the early 1800s, obstetrician James Blundell was losing patient after patient to a problem that still kills women today: severe bleeding after childbirth. Convinced that species might be the issue, he revived transfusion. But strictly human to human this time, one person's blood pushed directly into another's vein. Between 1818 and the late 1820s, he performed around 10 of these transfusions. Here's the part that should have solved everything. It didn't. Roughly half of Blundell's patients survived. The other half died, sometimes within minutes, even though the blood was human this time, not animal. If species had been the whole problem, human-to-human transfusion should have worked every time. It didn't. Something else was going on, something inside human blood itself that could turn one person's blood into poison for another, and there was still no way to predict which pairings would kill and which would save a life. For another 70 years, transfusion stayed a gamble. Doctors performed it as a last resort, knowing they were essentially flipping a coin with someone's life. Then, in Vienna in 1900, a pathologist named Karl Landsteiner noticed something strange in his lab that most scientists before him had simply brushed past. When you took the liquid part of one person's blood, the serum, and mixed it with the red blood cells of a different person, sometimes nothing happened. And sometimes the cells clumped together into visible little clusters, like curdled milk. Landsteiner didn't dismiss it as a lab error. He got curious. He drew blood from himself and 5 colleagues, separated each sample into serum and red cells, then mixed every person's serum with every person's cells in every possible combination, watching closely under the microscope each time. A pattern emerged. The clumping wasn't random at all. Certain people's blood reacted badly to certain other people's blood every single time, with total consistency. Landsteiner sorted what he was seeing into 3 distinct groups, which he labeled A, B, and C, the third later renamed O. A year later, 2 of his own students found a 4th group hiding in the data, one that reacted differently from all the others. AB. For the first time in human history, someone had found the reason blood transfusion had been a matter of pure chance for over 200 years. Certain blood types, when mixed, trigger a person's immune system to attack the incoming red blood cells as if they were an infection, causing that same clumping and breakdown that had killed patients since 1667, flooding the body with toxins in the process. Compatible types could combine safely. Incompatible types were, essentially, biological warfare inside a vein. The difference had been sitting there the whole time, invisible to every microscope, every theory, every well-meaning physician for 2,000 years, written into the blood itself. The effect didn't stay in a lab. Within 2 decades, doctors on the battlefields of the First World War were typing soldiers' blood before transfusing them, saving thousands who would previously have simply bled to death. Blood banks followed. Surgery, childbirth, trauma medicine, all of it became dramatically safer almost overnight, because for the first time, doctors could predict, rather than guess, whether a transfusion would heal or kill. In 1930, Landsteiner was awarded the Nobel Prize. Years later, he'd help identify a second hidden factor in blood, the Rh factor, explaining even more of the reactions that had puzzled doctors for generations. But here's what makes this whole story strange. Once you sit with it, long before anyone knew what a blood type was, cultures all over the world already treated blood as if it carried something deeply personal. Strangers became blood brothers through a shared cut, a bond considered stronger than any handshake. Families were called bloodlines, as though identity itself lived inside that red liquid passed down like an inheritance. Oaths were sealed in blood because somehow everyone agreed blood meant something no other substance could. They had no microscopes capable of proving it, no concept of antigens or immune systems, no idea that 4 distinct types were quietly running through every human population on Earth. And yet, for thousands of years, without a shred of scientific evidence, people acted as though blood carried a hidden identity unique to each person. It turns out they weren't wrong. They just didn't know how right they were.